Hello, and welcome to Pillow Talk. If you are at work or in a public place, go somewhere where you won't be embarrassed if a slide like this pops up on the screen. Because we're going to get really graphic. There's no such thing as TMI here. And since we're already discussing our vaginal secretions together, I'm going to introduce myself. I'm Lindsay, Ava's head of content. I've been running Ava's educational platform, Ava World, for the past 3.5 years. My job is basically to get inside the heads of women who are trying to get pregnant and answer your most burning questions with credible and research-backed sources. This comes pretty naturally to me because I very recently was a woman trying to get pregnant. I used Ava to get pregnant, and I gave birth to my son a little over a year ago. Here's what to expect from Pillow Talk. I'm going to teach you about the number one thing you can do to maximize your chances for pregnancy, which is to know when your fertile window is. There are a lot of misconceptions out there about when you're most fertile, and I'll make sure you know how to avoid these. I'll also explain exactly what's happening in your body so that you understand why your fertile window happens when it does. This will take about 15 minutes. After the 15 minutes are over, I'll answer your questions. Feel free to ask them as I go along so that you don't forget them. Just use the Q&A feature in the toolbar. One thing I have to get out of the way, this webinar is for informational purposes only, and we don't provide medical advice, diagnosis, or treatment. So let's jump right in. In some animals, like cats, having sex causes ovulation to occur. This is called induced ovulation. Human women, for better or for worse, don't work like that. Whether we have sex or not, whether we're in mood or have performance anxiety or are out of town, we ovulate once per month based on the internal and often inscrutable logic of the menstrual cycle. It would be way more convenient if we just ovulated whenever we felt like making a baby. But at least if we miss our one and only day of ovulation, it doesn't mean we've missed our chances to get pregnant for the month. That's because even though ovulation is only one moment in time, our fertile window is 6 days long. Healthy sperm can survive for up to 5 days in fertile cervical mucus. Once your egg is released, it can survive for up to 24 hours. Add together the maximum lifespan of the sperm and the maximum lifespan of the egg, and you get a 6-day fertile window in the best case scenario. I say best case scenario because it's not necessarily true that every woman in every cycle has a 6-day fertile window. The actual fertile window length depends on a variety of factors, including cervical mucus, sperm health, and probably other factors that we don't even know about. It's not just the length of the fertile window that's variable. The timing of when during your cycle the fertile window occurs is also variable. For 70% of women, the fertile window doesn't fall within what's thought to be the textbook average time with ovulation on day 14. Most women reach their fertile window earlier, and some reach it later. Knowing this, you can't help but wonder whether scientists have their definition of textbook cycle wrong. Using a period tracking app to track your personal patterns doesn't solve this problem because your fertile window may not happen at the same time every month. For 42% of women, the fertile window can vary by up to an entire week from one cycle to the next. Apps work by gathering data about your previous cycles and assuming that your future cycles will follow the same pattern. But we know from the research that women's bodies don't work that way. Just because you ovulated on day 15 last month doesn't mean that the same thing will happen this month. To really know when you're fertile, you need to use a method that tracks actual physical signs from your body, not just a calendar-based method. To explain how to do that, I'll explain a little bit more about how your cycle actually works. The first half of your cycle is called the follicular phase because that's when egg follicles are developing in your ovaries. The follicular phase begins on the first day of your period. A few days or so after your period ends, your estrogen levels begin to rise. The increase in estrogen marks the very beginning of the 6-day fertile window. Estrogen has a few different effects on your body. It causes your uterine lining to thicken so that it can be a nice, comfortable home for a fertilized egg. Estrogen also has a direct impact on your cervical mucus. When estrogen levels are low, cervical mucus is acidic and dry. As estrogen levels increase, cervical mucus becomes less acidic and more watery. Just before ovulation, it becomes very wet, slippery, and stretchy. This type of mucus protects sperm and helps it travel toward your egg. This relationship between estrogen and cervical mucus means that you can know what's going on with your estrogen levels just by looking at your mucus. These changes are easy to observe yourself. If you produce a lot of cervical mucus, you might notice it on the toilet paper when you wipe. If you don't, you might have to reach into your vagina with a clean finger to see what comes out so that you can examine it. The highly fertile kind of cervical mucus will often stretch a couple of inches between your fingers without breaking. And if it doesn't weird you out too much to taste it, you will notice that it tastes less sour when you are very close to ovulation, which is because it is less acidic. Another way of thinking about this is that most of the time, your cervical mucus is a sperm-killing machine, but for a few days of your cycle, cervical mucus becomes much more like semen, which obviously sperm like very much. Cervical mucus is a key factor in determining how long your personal fertile window is, because it influences how long sperm can survive. So if you're trying to get pregnant and you see fertile cervical mucus, you should definitely have sex. There's one exception to the rule that you should have sex whenever you see fertile cervical mucus. If you see fertile cervical mucus after ovulation during your luteal phase, it does not mean that you're fertile. Estrogen levels are high in the days before ovulation when you're very fertile, but estrogen levels also very briefly increase after ovulation during your luteal phase. For some women, this means they can experience a day or two of the type of mucus that looks very fertile. But since this is after ovulation, you're no longer fertile for that cycle. Now, you might be thinking that if cervical mucus is so good for fertility, that you should go out and buy some fertility-friendly lubricant, like pre-seed, for example, to help you boost your chances. This leads me to Ava's first insider tip for you. Lubricants marketed as fertility-friendly do not boost your chances. There is some evidence that conventional lubricants may hamper sperm's ability to swim to your egg, and fertility-friendly lubricants do avoid this, but they won't make you more fertile or more likely to conceive. If you generally like using lube during sex, it's a good idea to switch to a fertility-friendly version while you're trying. But if you don't usually use lube, you don't need to start. Anyway, going back to where we were in the follicular phase. When estrogen levels get above a certain threshold, that triggers a sudden surge of luteinizing hormone, or LH. LH sends a message that it's time to release an egg. On average, ovulation happens 24 hours after the LH surge first begins, though there's a lot of variation from woman to woman in how long the LH surge lasts and how soon after the initial surge ovulation occurs. This is a chart of what a textbook LH surge looks like. The LH surge, represented by the solid line, lasts for about a day. About 1 day after the LH surge first begins, ovulation occurs. You know that ovulation occurred in this chart because progesterone, represented by the lighter dotted line, starts to rise. The only problem is, not every woman has this textbook LH pattern. For some women, ovulation occurs less than 24 hours after the LH surge begins. And for other women, it happens a couple of days later. And some women have multiple LH surges before they ovulate. This is because LH is a sign that your body is gearing up for ovulation, not a guarantee that it will successfully happen. The upshot of all of this is that many women use ovulation tests wrong. Ovulation tests, if you're not familiar with them, are urine tests that detect the presence of LH. They're supposed to tell you that you're going to ovulate in the next 24 hours or so. But depending on what your personal LH surge looks like, this might not be true for you. An even bigger problem is that your best days for conception are the 2 to 3 days before ovulation. This means that for many women, the most fertile days occur before the ovulation test even turns positive. So this leads to the next insider tip that we have for you. Let's see, okay. Yeah, if you wait for an ovulation test to have sex, you could be missing your very best days. You should think of the LH surge as the beginning of the end of your fertile window. Using LH tests puts a lot of focus on the day before ovulation and the day of ovulation, but this goes against what the evidence says about the best days to conceive. The 3 days leading up to ovulation carry better chances of conceiving than the day of ovulation itself. Having sex on any one of those days carries up to a 20 to 30% chance of conceiving. In fact, there are even studies that suggest the chance of early miscarriage is higher from sex on the day of ovulation, perhaps because the egg has aged by the time it gets fertilized. This leads to the next insider tip that Ava has for you. You don't need to focus on ovulation day to maximize your chances. This doesn't mean you should avoid having sex on the day of ovulation. First of all, that would be hard to do in practice because you never know for sure what day is ovulation until it's over. So by trying to avoid ovulation day, you'd probably end up just having less sex during your fertile window and decreasing your chances overall. Secondly, the overall risk of miscarriage from ovulation day sex is still low, and there's only an increase in the risk of very early pregnancy loss from sex on ovulation day. For pregnancies that make it to the 6-week mark, there's no increased risk of loss. What all this does mean is that the key to getting pregnant faster isn't so much about determining exactly when you ovulate, but instead determining the beginning of your fertile window, when your estrogen levels first start to increase. But how do you know when you're at the beginning of your fertile window? This is exactly what the Ava bracelet is focused on. It started a few years ago with one of Ava's founders, Pascal, whose wife was using the temperature method to track her cycle. With the temperature method, you have to take your temperature at the same time every morning and keep track of the results in a chart. When you see a rise in temperature, that confirms that ovulation has occurred. Pascal thought that with all of the advances in wearables and sensor technology in recent years, there had to be a better way to track the cycle. He started thinking that if temperature changes so drastically during the menstrual cycle, there must be other physiological parameters that change too. And maybe some of them changed before ovulation in relation to estrogen and could reveal when the fertile window was first beginning. So he gathered together a team to look into it, and they found that multiple other physiological parameters changed during the cycle, not just temperature. Earlier this year, Ava published a clinical study validating these findings. The study, which was published in a peer-reviewed journal, demonstrated changes in 5 different physiological signals of fertility. Ava uses these changes to detect your fertile window in real time. You put Ava on only at night because it's only during sleep that your physiological parameters reach their baseline levels. During the night, Ava continuously collects information about your resting heart rate, breathing rate, temperature, heart rate variability, perfusion, and sleep patterns. In the morning, you sync the Ava bracelet to the Ava app on your phone, and Ava updates your fertile window prediction based on the data gathered from the night before. The benefit of using Ava is that it detects 5 fertile days. And since you now know that the 3 days before ovulation are your most fertile, you can see why getting a 5-day heads up about your fertile window could be a huge game changer when you're trying to increase your chances. Before I end things, there's one last insider tip that I want to share with you. If anyone has ever told you that you just need to stop stressing about getting pregnant, this is for you. Some women get pregnant quickly and some don't. If you're in the latter group, it doesn't mean that you're less of a woman or obsessed or broken. All it means is that you have a harder time getting pregnant, so you're more likely to do something about it. When someone tells you to stop trying so hard, it can feel like they're saying that you're a baby-obsessed loser, and that if you really deserve to get pregnant, it would just happen naturally without even trying. Some people get pregnant quickly, some take a little more time, and the difference has nothing to do with your value as a person. But one thing is certain, there's no shame in yearning to be a parent. It takes bravery, it takes vulnerability, and yes, sometimes it takes effort. Most worthwhile things in life do. Okay, that's all I have. If you have questions, you can answer, or you can ask them with the Q&A feature. And I also got a bunch of questions that people sent in beforehand. So I'll start by taking those up. So Tatiana T said, does the Ava bracelet work on women over 40 who are still ovulating and capable of getting pregnant? Yes, age has nothing to do with whether the Ava bracelet works for you or not. It's really about whether you still have a menstrual cycle and are still ovulating. So Ava's guidelines for use are your cycle should be within between 24 and 35 days. And so if you're over 40 and your cycle is still happening within that time frame, Ava's a great product for you. Okay, let me see the questions that just came in. How much is the bracelet? It's $299. Is Ava effective when I'm using Clomid? That is a good question. So it hasn't, our clinical testing didn't include testing women who are taking Clomid or letrozole or any other, fertility medications or progesterone. What we've observed anecdotally among the women who are using it, that usually you take that medication because there's like your cycle is irregular or you're not ovulating, reliably. And so your Ava chart on those cycles tends to just look more typical and textbook and normal. But that said, we haven't done any specific testing on it. So like, it's not, you can't like guarantee anything. Does Ava work in ladies with irregular periods? So I said before that the guidelines for use are your cycle should be between 24 and 35 days. That's for Ava's automatic fertile window prediction feature to work. So if your cycles are outside of that range, you'll still see all of the data. You'll still see your temperature data. You'll still see everything. You just might have to do a little bit more detective work on your own to decipher what that means. Like the kind of like you just put it on and it tells you everything. That part doesn't work if your cycle is outside of the 24 to 35 day range. Okay, what's the next question? I understand it has not been tested in PCOS. If you have PCOS with generally regular cycles and regular ovulations, is there a chance that AVA could still be reliable? Yes, there's a chance that AVA could still be reliable. I'll say that anecdotally, we've seen that people in our communities that, you know, they maybe have mild PCOS, and like, yes, we've seen that sometimes it can still give a fertile window prediction, but I also want to say that it hasn't been tested in this scenario, and so there's no guarantees. Also, hang on, my door just opened. Let me close it so there's not noise coming in. Sorry about that. Okay. Cool. If I sleep sometimes more than 4 hours at night and sometimes in the morning, will AVA still be able to predict if I'm not sleeping at the same time all night, as long as I wear it when I'm sleeping? I'm not sure I totally understand. I think what you're asking is if you don't sleep at the exact same times every night, if you have like a variable schedule, will AVA still work? And yes, it should still work as long as you're sleeping those, that 4 hour chunk. But feel free to ask that again if I didn't understand. Okay, going back to the questions that people asked before, because I think I've answered all of the live ones. Let's see, how can I use ovulation predictor tests and cervical mucus tracking in conjunction with AVA? Or are these even necessary when I'm using AVA? So you don't need to use anything else when you're using AVA. The whole idea of it is that it's just, women do too much work already when it comes to tracking their fertility, and we wanted to make something that it's a one-stop shop. You just put it on at night, sync it in the morning, and you know when your fertile window is. That said, a lot of women do use all of these other methods. I've used everything when I was trying to get pregnant because I just wanted to have as much information as I could, and that's fine. And I think this person wanted to know, like, what's the right time to start using those different tests? And I have a really good trick for that. If you're not sure when to start using OPKs, you should wait until your cervical mucus starts to change, because OPKs look for, or ovulation tests look for this increase in LH, but that increase can't happen until your estrogen levels go up. And so from this presentation now that your cervical mucus tells you what's happening with your estrogen levels. And so if you wait for that cue for your cervical mucus to start changing that says, oh, your estrogen levels are going up, then you should start maybe taking ovulation tests, because that's when you should expect your LH surge to be happening soon. Okay, another question came in. Hello, I'm almost 38 years old and we are starting to try to conceive. It gets me really sad when I see a negative result on an ovulation test. I'm regular with my period, and the doctor said that if after 3 months we don't get pregnant, we have to go back. Is this a good time to wait to get pregnant because of my age? And where can I get AVA, and how effective is AVA for me to try to conceive? Thanks. I think there were some medical questions in the beginning that I think are better for your doctor. And how effective is AVA for me to try to conceive? AVA is 89% accurate at identifying 5 fertile days per cycle. We don't share information around like how likely is it for you to get pregnant if you use AVA, because what AVA is designed to do is identify your fertile window. There are a whole bunch of different kinds of women using AVA, some who have no underlying fertility issues, some who have had infertility for years, others have PCOS. We don't control who our user base is, and so for that reason it wouldn't be very accurate if we kind of said, oh, these people, like our AVA users, get pregnant after X amount of months. We want to be really accurate with the information we give, and I think that wouldn't be helpful for people. Okay, going back to the questions we got before. This person says, I'm an avid cyclist, which I need to continue for my own mental and physical health. I require more exercise than others as it calms me down, and my period is very short, usually only 2 days. Should I be concerned about my ability to get pregnant? That's a really good question. So there is, exercise does have the potential to impact your fertility. Exercise is generally very healthy for people, but if you're under fueling for your activity levels, which sometimes you can do without even trying, it can have an impact on your cycles. And there's a trajectory of changes that happen. Usually it will start with a shortened luteal phase, then it can go to just like irregular cycles, then it can go to anovulatory cycles, and at the most extreme end, you can lose your cycle altogether, which is something called hypothalamic amenorrhea. And this can happen when your body is stressed because you're exercising too much and not eating enough. It can happen because you're just not eating enough at all. Like even if you're not exercising, there's just any kind of like buildup of physiological stress can cause this. This isn't something that like, if you're just like a generally healthy person and, you know, haven't lost a bunch of weight and aren't being really extreme about it, it's not like you should worry if you're exercising that this will happen to you. But definitely if you started something new in your routine and you notice something in your cycle changed, you should consider whether, you know, that is related to changes in your lifestyle and your eating or your exercise habits. Okay, I'll read like one or two more of the questions that came in before. I'm confused if Ava will know when I'm pregnant. Will it detect certain changes and notify me that these changes could mean that I'm pregnant, or will it just continue assuming that I'm not pregnant? Okay, Ava's not a pregnancy test. So definitely anecdotally, we see that certain things that overall among women who get pregnant, their cycles, their charts look different. Temperature and heart rate tend to go up, but not on like a perfectly like hot, like it's not like they'll go up and up and up forever and they'll never dip down. So we do see these changes, but you can't really use it as a pregnancy test on an individual level. If you think you might be pregnant with Ava, you should take a pregnancy test, and then you switch to the pregnancy setting in Ava, and it's a whole different experience in the app. It doesn't just automatically detect it. Ooh, we got 4 new questions that came in. Okay, we'll do this for like 5 more minutes. Okay, if we can only have sex every other day during the fertile window, which days are the best? So the answer is we really don't know. The 2 to 3 days before ovulation you should assume that they're all basically equally good. So as long as you hit any one of those days, you're doing a great job. And also I think the way you phrased this question, if we can only have sex every other day, it sounded like, you know, oh, it's too bad we can only have sex every other day. But that is actually great. You like the studies that look at people who have sex on like only one of those most fertile days versus hitting all of them, there's like barely a difference in the increase in chances. It's effectively the same. And so it doesn't look like, you know, hitting all of those days really gives you a benefit compared to hitting just one of them. So don't like go crazy like and make sex very rote by trying to hit all of those days, because it doesn't really help you that much. Okay, how long should I track my fertile window with Ava before trying to conceive? How much data does the Ava bracelet need to accumulate before predicting an accurate fertile window? So Ava does need to learn your body, and we see that the steepest learning curve happens within the first 3 cycles. And so I'd say if you have time and you've been planning ahead, I would get it like 3 cycles before you start trying. That said, sometimes it's accurate on the first cycle. It's just that it can take up to 3 cycles before it figures out your body fully. When estrogen rises after period, are there any other symptoms other than cervical mucus, such as breast tenderness? So the reliable symptoms that happen for most people are cervical mucus and cervical position. Breast tenderness and other like mood changes, headaches, things like that. Those can vary a lot from woman to woman and from cycle to cycle. Also ovulation pain, that's something that like some women have and some women don't, and you don't have every cycle. So none of those things should be like conclusive signs that you would predict your fertile window based on, even though they might happen. Let's see, does it matter when in your cycle you start using the Ava bracelet? No, it doesn't matter if it arrived in the mail and you want to start using it, you can just go ahead and start using it. The only thing is, of course, if you put the Ava bracelet on for the first time after you already ovulated, it won't predict your ovulation for that cycle because you already ovulated. But you don't need to if you got it in the mail, you don't need to wait for your next cycle several weeks to start to put it on. You can just start right away. Another really important thing, this is kind of related, but a lot of women are used to, if you're used to using the temperature method, for example, some women stop taking their temperatures after they confirm ovulation because they're like, oh, I don't want to do this. Like, it's annoying and I'm done. With Ava, you can't use it like that. If you see on Ava that you ovulated, you have to keep wearing it and like continuously, like through your luteal phase, even though you already know you ovulated, because that's when Ava does its correction and learnings about your body. Like, that's how it improves. So you have to keep wearing it. Now, like another insider tip is that, so it can be stressful to like look at your data every day when you're in that 2-week wait. And so you can wear it, but not sync it. You can wear it and then just sync it every like 4 or 5 days. And so you don't have to be like waking up every morning anxious about seeing what your AVA data says and seeing, oh, did my temperature go up? Did it go down? Does it mean I'm pregnant? So yeah, it can hold multiple nights without syncing. Okay. I think there's no more questions. So that's all. Thank you guys so much for joining. This was super fun, and I hope that everybody learned something. Okay, bye.